Today, our featured speaker is Dr. Mikhail Varshavski, commonly known as Dr. Mike. Dr. Mike is a board-certified family medicine physician who believes in preventative care and educating individuals on how small lifestyle changes can make a big impact on the quality of life and health outcomes. As a leading social media influencer in health and medicine, Dr. Mike motivates, inspires, and advises millions of his followers and fans. He uses his platform to discuss and raise awareness on a broad range of global health and medical topics, from COVID-19 and misinformation to tips on how to reduce cancer risks, improve nutrition, incorporate exercise, apply new ways to reduce stress, and in general, how to live a better life. Thank you very much, Dr. Mike, for being a part of our Global Health Leaders Conference at Johns Hopkins. The virtual stage is yours.
Thank you so much for that introduction. I probably got way more credit from you than I deserve. I thought a great way to start this off is obviously by thanking everyone for coming. It's a difficult time. There's no other way to put it. It's difficult no matter what boat you find yourselves in. Everyone has their own journey. So whatever you're going through now, make sure you validate those feelings. You really check in with yourself, both mentally and physically, because a lot of times, especially as you become further in your medical education, you'll learn that ignoring some of these issues will yield bigger problems later on. And that's actually part of being a family medicine physician. So checking in with yourself before, after this talk, please do it. It's really important. And make sure to validate your own feelings. I think a great way to start would be for me to share sort of my journey of how I've gotten here, because I've had a very strange journey of how I've come to this point of educating what seems to be, I mean, it's weird saying it even now, millions of people online instead of the 30, 40 patients I see a day. This journey really started when I was in medical school and I was studying for my boards. And I was sitting in a library with a friend of mine who was in nursing school studying for his boards. And he was taking pictures of the sky through this small little window in the library. And I was like, what are you doing? You're procrastinating. Stop it. We're taught not to do this. And he's like, no. There's this new app where if you take a picture of the sky and you do #sunset, a bunch of people are going to come and like your photo and you're going to get a lot of people talking to you. And I was like, what is this app? I've never heard of it. He's like, it's called Instagram. And to me, as someone who's never had social media prior to that, I was like, oh, that sounds like a cool app. I wonder what you could do with it. And sort of in the back of my mind, I started wondering how I could make use of this platform. It did not start off as this truly altruistic goal where I thought I could do great for society and I could educate people. It was just cool. That's all it was. And it was an opportunity to sort of share what I was going through. People had blogs in the past, people had MySpace. I thought this could be my place where I share my life as a medical student. And throughout my medical school training, it slowly grew on its own, but it never really took off until I was actually already a physician. It was at the end of my first year being a medical resident, which is actually your hardest year as a resident, that BuzzFeed wrote an article about me. It wasn't an article praising the fact that I had research published, that I've written a chapter in a medical encyclopedia, that I was the youngest doctor in my hospital because I did a combined undergrad and medical program together. It was, check out this doctor, this hot doctor, and his husky. It was a very superficial article, and the amount of attention I received that week will never be the amount of attention I'll receive ever again in my life. My Instagram following spiked by 1 million people in what seemed to be a matter of days. In fact, if I had my phone open and the notifications on, the phone would freeze and get overheated and it would just die. Like that will never happen again in my lifetime. Now, this was a weird place for me. It was a weird crossroads because here I am studying to become a physician as early as possible. I'm motivated. I've done the research. I've passed all my tests. I wanted to do well, wanted to do right by my patients. And then all of a sudden I'm getting all this media attention and I have no idea what to do with it. Ellen DeGeneres is calling. Steve Harvey's calling. The Doctor Show is calling. Come on our show. And I'm learning really quickly that no one really cares about you. They're saying like, come on our show, but don't do theirs. If you do theirs, you can't do ours. It's not like they genuinely wanted you to share your story. And I received a really quick media PR lesson super quickly that time is everything, that not everyone is on the lookout for your best interest. And it was a hard lesson, but it's an important lesson to learn. So then I started thinking of, okay, well, let me go on the smaller shows. And they're inviting me strictly because of this hot doctor thing. That's how they're going to get their viewers. That's what their responsibility comes from. It's, yes, to tell a good story, but primarily it's to get more viewers. And to them, this hot doctor angle worked. So I said, okay, I'll go on these shows. And instead of talking about myself the whole time, I'm going to move the conversation to how can we improve our lives through our lifestyle habits? What part of medicine is absolute BS that is taking away money from our healthcare system and instead putting in the pockets of pharmaceutical companies? And that was not an easy transition to make, especially from someone who has no medical media training or media training at all. I was not even a public speaker. Like I've never done that before. But I viewed it as a very lucky opportunity and a blessing to take this sort of unique situation and take the controversy that comes from the title Hot Doctor and use it to get people to pay attention to really important and meaningful messages. And when you look at some of the doctors that are in the media space right now and have been in the last 10 years, they actually have been forced to corrupt their medical information in order to get this audience to come. Whether it's through miraculous detox cleanses or supplements that will solve everything that ails you. That is how they gain an audience. I said, I want to be the doctor that puts out the most accurate, up-to-date, honest information. And then, because I was lucky with this hot doctor thing, uses that as the hook to get people in. It was like, come for the controversy, stay for the content. That was my motto. And it was a very difficult journey because I had no help here. I had no real role models to look to. And that's something that you guys have a tremendous advantage in, to look at me and not look at my successes, but see where I've failed, see where I could have done better, and learn from my mistakes and do better for the world now. In fact, this moment that we're going through as a nation with COVID, with racial discrimination, police brutality, this is a learning opportunity that we didn't ask for and that probably we wouldn't want because there's a lot of pain that comes from this. But through this pain and through the mistakes that I've made and our society has made, we can come out better. You may think that it's not relevant to what I'm talking about, but it really is. Like, racial discrimination plays a role in health so far beyond what we even understand. It's crazy. And we may not be at a place right now, especially with the emotions that we're battling with as a nation, to be truth-seeking, because truth-seeking is uncomfortable. It's difficult to sometimes admit we're wrong when we should. So in times where we're not truth-seeking, the things we should be doing is being empathetic, understanding, listening, asking questions about how we can improve. And once we get to that point, then make that slow, gradual transformation to truth-seeking. Because at the end of the day, each and every one of you, whether you become doctors, nurses, PAs, researchers, whatever role you play in our healthcare system, you need to be truth-seeking, you need to be empathetic, and you need to be humble. Those three values will not only take you a long way as a practicing healthcare provider, but also a long way as a human. It will pay dividends in your relationships moving forward. And I know that's a weird philosophical statement, again, from a guy that laughs at medical memes and plays Minecraft on his YouTube channel. But it's something that I've learned on my own, and it's something that I want to pass on to you. And I think before anything you do in this life, whether it's choose a partner, choose a career, choose what you're going to eat today, you need to know yourself. And how can you know yourself? You got to get out there. You got to experience stuff. You got to put yourself in uncomfortable positions. You got to have uncomfortable conversations. You got to look at things you might not like. And once you do that, you really put yourself in a prime position to grow.
Sure. Well, thank you so much for the insightful presentation, Dr. Mike. We'll now be shifting into our question and answer session. where Dr. Mike will be answering some of the questions you all submitted. Questions cover a variety of topics from social media and misinformation to the challenges of being a physician and a social media influencer. Our moderators will be a few of our conference board members.
Great, so to start off, our first question is from the conference board. During the COVID-19 pandemic, there has been increased racism towards Asian communities, and currently racism against people of color is at the forefront of discussion in the current political landscape. How do you advocate against racism as a physician and as a social media influencer?
This is probably the touchiest but most important subject that we're going to talk about today, because not only does this speak to the health of our global community, but it also talks to our global humanity. And the thing that I do, and I urge you to do, is to hold people accountable. But wait, I don't mean shouting people down. I don't mean calling folks racists. I don't mean getting angry. While those things will happen, and I'm not saying if you do these things, you are necessarily wrong. My goal as someone who's studied psychology a lot, who's spent a lot in understanding what drives people to click, to listen to my medical advice and change their lifestyle, to get a vaccine when perhaps they were vaccine hesitant before. That type of psychology starts with one step: empathy, understanding, beginning the conversation, and really striving to understand someone else's perspective without agreeing with it. Looking at someone as a doctor, I have to be empathetic to that person. It doesn't matter what my emotions are. I have to be empathetic. I have to understand this human suffering. And the more we strive for this level of empathy, we can hold people accountable. I've reached out to some of my colleagues who people were outraged that they were silent during this time, when many people are understanding we have to speak up. But I think it's not important that we reach out to them with hostility, with calling them out, with canceling them. We have to approach it by being genuinely curious about their position and then understanding where that position comes from. Because you cannot change a person's mind until they A, like you, and B, you truly understand what the foundations of those beliefs are. And that applies to racial discrimination as much as it applies to whether or not a patient takes their cholesterol medication. I've had some of the most staunch, silent people who didn't want to speak up change their minds because of these conversations. I've had people who never would vaccinate their children say, okay, I'll get some of these vaccines to start and see where we go. And I urge you to experiment with this platform yourself, because it's not just about having a conversation in person because it's COVID time. It's about using social media. It's about using Zoom, other avenues at our disposal. Be creative with it. Do it in a way that I haven't yet figured out how to do it, because there's no right way to do things. In fact, when I started my social media journey, people said that it wasn't professional. People said that doctors shouldn't be on social media. Doctors shouldn't be good marketers. But I think that idea that doctors shouldn't be good marketers is false. Doctors should not be marketers for nonsense. Doctors should not be marketers of inaccurate information. They should be marketers of tolerance, empathy, evidence-based medicine. And in order to do that, you have to be a marketer. You have to understand influence, but you have to use it for good. It's not manipulation. It's positive influence.
Thank you so much for answering that question. So our next question is about social media and mental health from Samara Rezwan, who goes to Wausau East High School in Wisconsin. So her question is, it is commonly said that social media should be avoided, or that one should take a break from social media to improve his or her mental health. As both a physician and a social media influencer, do you feel that social media can actually be utilized to improve one's mental health? And if so, how?
Very great question. I think social media has harms and benefits. Every time I write a prescription for a medication, a surgery, a therapy, they always carry risks and benefits. And the idea that you'll learn as you become a healthcare provider is maximizing those benefits and minimizing the harms. In fact, the first principle is do no harm. But sometimes with medicine, if the benefit is so high, doing some harm might be okay. And like a great example of that is someone who frequently experiences blood clots and gets clots in their lungs that could potentially kill them. We give them a medicine to decrease those clots. But now that's the benefit. The harm of that medicine is they could potentially bleed out faster if they have an accident. But you constantly need to play that balancing role. So with social media, the way that I treat it as a doctor is I look at the benefits and I look at the harms, and I think about not villainizing social media and saying because it has harms, we should get off of it. We should be focusing on how to maximize the benefits, and there are true benefits. We know the harms because people like to talk about harms. There's a power in talking about negative things. We have a negative bias, an inherent negative bias in our minds as humans. That's how we've survived this long. But we need to think about the benefits. And I look at some creators out there, and they're doing really great things with their platform. They're educating. They're using it for their own well-being as an outlet for them to be able to talk about difficult subjects. They're raising awareness for issues that are important to them. They're raising funds to change the world because at the end of the day, we know money makes the world go around. But if we can use the collective power of this money for good, that's a very powerful way to move that needle. So we need to look at the benefits and amplify the benefits of social media, but we also need to pay strict attention to the harms and see how we could minimize that.
Thank you so much, Dr. Mike. So this next question is based off of questions from multiple students about a challenge that physicians may face when caring for patients. As different cultures have different views of medicine and mental health, how do you help your patients while respecting their cultural boundaries and beliefs?
I think the way that I go about that is I come in with as limited preconceived notions as possible while still being a good doctor. What does that mean? That means I can't assume why my patient is feeling a certain way. I need to be able to ask that question. I can't assume that they know all of the medical vocabulary that I know. So I need to be attuned to that. At the same time, I need to be able to assume certain things about my patient to know what risks they're facing. For example, if they're a female in their 50s, I need to know that they're facing a breast cancer risk. That's an assumption I need to make. If I have a patient from a specific Jewish heritage, I know that they may be warranting a genetic test to see an illness that they could potentially be at risk for. So there's certain things I need to come in as an open book and ready to learn about the patient sitting in front of me. And certain things that I also need to bring with me to say, how can I make sure I'm not missing anything for you that you might not even know you're facing as a risk? And now more than ever, we need to be able to come in with this low level of assumption and curious to learn about the person because we're all different. We all have different reasons for why we struggle to do something, the challenges we face. And in fact, as an osteopathic doctor, I'm a DO, not an MD. One of the biggest principles I'm taught is you have to look at the person as a whole. Like, I hate the fact that I have to sit with the keyboard like this and punch away on it on the electronic health record when I'm talking to a human. That this is not right. In fact, I got in trouble for this when I was a resident because you had to finish your notes while in the room with the patient. I said, no way. No way am I going to be paying attention to this when there's a human in front of me struggling and I don't yet understand why. This can wait. And I think when you put the human as a whole first, not this diabetic, but this human with diabetes who's going through a divorce and has to work 4 jobs and is facing racism and police brutality as an issue, now we're getting somewhere. So it's really about taking that journey and not being able to, it's not being lazy and force yourself to come in and genuinely want to know about the person and genuinely put the effort in to getting to know how you can improve someone's health.
Thank you so much, Dr. Mike, for your really thoughtful answers. We really appreciate it. So our next question is from Nikita Kunimuru of Downingtown STEM Academy in Pennsylvania. Her question is, you mentioned in one of your videos that expert opinion should always be lowest form of evidence, in part due to medicine being an imperfect science. I often feel like that is not emphasized enough in the media, where it is often made to seem like that person's word is law. So how can the media emphasize this more, especially during these turbulent times? Thank you.
Oh man, that's such a great question and something I'm so passionate about. Maybe I can even begin to unpack why expert opinion should be the lowest form of evidence and how we go about it. For example, as a doctor, if I have a diabetic patient, how do I, or a patient with diabetes, see, I even need to check myself sometimes. If I have a patient with diabetes and they're coming in with very high blood sugar, how do I know that by lowering their blood sugar, I'm doing them a good service? It's not because I'm an expert and I know everything. No, it's because I looked at quality research that has been done in randomized controlled studies, which is the gold standard of research. And we've compared not acting or maybe acting in other ways in comparison to this. And we found this is the best way. That's why I'm making the recommendation. In fact, people oftentimes ask me, like, Mike, how are you comfortable talking on topics where you might not be an expert in? The reality is I'm not even really an expert in anything. I'm a family medicine doctor. I have to be comfortable talking about anything. But what I do have is access to experts and their databases of where they teach me. And then I can then translate that information to my patients. We don't have all the answers. And in fact, if there is a gap where we don't have research, which happens all the time, we oftentimes have to rely on expert opinion or groups of experts' opinion. And we know that's poopy evidence. We know it. We just don't have anything better than that. So in those instances, we have to, when we go into an interview, we have to state that. We have to say that we don't have good evidence for this. We have to say that this is what we assume is happening. We have to approach it with that level of humility. And I think news organizations have to shift their focus, at least somewhat, away from the fiduciary responsibility, the financial responsibility to their shareholders to get clicks and views, to also a responsibility to get accurate info. And I don't want them to hear a doctor say, I have an expert opinion that's different than everybody, and say, oh, this is going to get us views, let's get them on. That's going to confuse people. We have to trust that the research we're doing is accurate, and at the same time call out where we don't know and call out where we failed. So we have to acknowledge that expert opinion is the lowest form of evidence, teach people why it is that, and if we mess up with our expert opinion, quickly correct and explain why we thought it before and why we've changed our minds now. And explain that if we look back at medicine 100 years from now, half the stuff that we're doing now is going to look barbaric. But guess what? We don't know what that half is yet. That's why we need more research, and that's why we need to fund our research institutions more than we do now.
Thank you again, Dr. Mike, a very thoughtful answer. So this next question is by Stephen Wu from Camas High School in Washington State. As a healthcare provider, what was the greatest challenge your healthcare system faced in the midst of the COVID-19 pandemic?
The biggest challenge we face is being able to deliver care to patients who can potentially get sick, not even with just COVID, but also with all the other illnesses that don't go away just because we're in the middle of a pandemic. People are still having heart attacks. People's sugar is still not controlled. People still need cancer screenings. How do we manage all of that while maintaining a decreased transmissibility of this virus? And part of that is making use of technology. In fact, the setting where you see me sitting in right now is how I see patients. Tomorrow morning, I have hours where I'm going to be seeing patients in exactly this format. I've never done that before. My hospital system has never done that before, but we have to make technology our friend and figure out how it can help us take care of our patients during a time that's really unprecedented. At least in my lifetime, there's never been something like this where we all stay home and I have to deliver care from home. It's really hard. Like, I'll give you a brief example. I had a patient the other day who was complaining about some back pain, some lower abdominal pain. And some of the things that I would think about would be, okay, let's make sure the urinary tract system is okay, that it's not one of the most common things, a urinary tract infection. What would I do in a physical? I would press on the bladder. I would press on other areas of the stomach where the intestines are, where the appendix is. I would do some tests on the patient's back to see if the kidneys are infected. How am I supposed to do that sitting from home? It's tough. And there's no real answer to it. No one has the answer. But we have to figure out how to do the best given the limited set of resources we have. And I've been even speaking bigger than this COVID-19 pandemic. I remember being on an airplane just last year and someone's having an anaphylactic attack over the Atlantic Ocean. They ask, is there a doctor on board? And I jump up and I say, I'm a doctor. And now I realize without an EpiPen, I have no idea what to do. Like in the medical setting, I'm so comforted and I have it so easy that I can just grab a crash card. I have nursing assistants. I have specialists at my disposal. Here I'm on an airplane 30,000 feet in the sky without an EpiPen. And I'm starting to figure out that this is not easy, but it doesn't matter if it's not easy for me. This person's about to die if I don't act. So I'm sitting there calculating dosages of the epinephrine that we use for heart attack patients to give as a dose for an anaphylactic allergic attack. Then I'm starting to think, what do I do if that doesn't work? And in our hospital system, we can intubate someone, but I don't have an intubation kit. Can I make a hole in their neck? With what? And I'm sitting there thinking, like, do I grab a pen? It felt like an episode out of Grey's Anatomy or House. But sometimes you have to do that. And I think this pandemic is really an example of where we have to really be able to be adaptable. And that goes further than the COVID-19 pandemic. It applies to each and every one of you. You're entering different stages of your schooling. Some of you early on in your high school career, some later, some maybe even in college. Be adaptable. I know it's shitty when things change. It's shitty when you've been ready for something for so long and all of a sudden it changes. Lean into that uncomfortable state because boy, it's going to pay dividends down the line. That's what really makes you a good human and a good physician.
Thank you so much. So our last question for today will be regarding misinformation, and similar questions were asked by multiple students. So this question is from Nicole Liang of Morgantown High School in West Virginia. Her question is, how should the general public determine which information they see is accurate and what is simply sensationalism in regards to global health and medical topics?
So that problem is for the general public as well as to us in the healthcare space, and to the platforms themselves. And everyone has a different role. Platforms are trying to boost up authoritative content, meaning accurate, correct information, and downvote the other content. And that creates a lot of censorship issues. Do you take down content that's inaccurate? Do you allow it to stay on and allow people to have that discussion? And there's no right answer to this. It always depends on the individual situation. And it's something that they're struggling with. They're asking me this question every day. As far as from our healthcare provider standpoint, I think we have an obligation, not all of us, but on a macro sense, to be there, to be where our patients are, to be where people are, which is social media, to be able to give counter information, the good information, when something comes online that's inaccurate. And I think the lack of doctors, nurses, medical professionals, researchers on social media has really allowed those to hijack the social media space to put out a lot of nonsense that's confusing people, causing people to put their lives, their family lives at risk. I mean, part of the initial protests, not the ones that are going now, but the ones that were going on about COVID, were because people were ill-informed because of that misinformation. And as a doctor, you hate to see that. But at the same time, we have to take it upon us to have that conversation with a level of empathy with those who disagree, and then also be not afraid to do better and put our own information out there. That's what I do. From the general public stance, I think I would say they probably play the smallest role in this because we can't expect them to know what good information is. How, as a person who's working 3 jobs, who's facing injustices, who's trying to raise children, who works in a completely unrelated field, how can we expect them to know the difference between a randomized controlled study and an anecdotal study? I mean, it's almost impossible for them to know that. I mean, some do, and that's great, and I want to increase education, but realistically, it's really hard to force people and to get them to know everything, especially information moves so friggin' quick. I mean, just look at how fast we have to update our iPhones. Like, I have to learn a new iPhone. I feel like I'm sounding old, but I have to learn my new iPhone. It seems like every few months, a new app, a new communication tool, a new electronic health record. Man, like, I struggle with this, and I'm someone who should be used to this. Imagine someone who has to work 10 times the way that I do, or facing 10 times the challenges that I face. How are they expected to do that? The only thing I can ask of the general public is, if something sounds too good to be true, approach it as a healthy skeptic, not a cynic. Not disbelieve everything you hear, but be skeptical to the point where I want to know more. Have it fuel your curiosity. Don't necessarily share it for the world, because that's how bad information spreads like wildfire. That's why the internet is a misinformation superhighway. Instead, create a conversation with a trusted expert. Bring it up the next time you speak to a nurse, to a doctor, to someone that takes care of your health, whom you trust. And by starting that conversation, you're already taking away the power by how this misinformation spreads. And I don't think that's a crazy ask. It's a pause and reflection. That's it. That's all I ask of the general public.
Thank you, Dr. Mike. So with that, we will be concluding the question and answer session and Dr. Mike's presentation at our Global Health Leaders Conference this year. Dr. Mike, on behalf of our conference directors at Johns Hopkins and all of the students in our program, thank you again for being a part of our conference this year. We appreciate all you do, and we wish you the very best.
Thank you so much for having me, for giving me the opportunity to speak to the future leaders of our world, the ones that are going to be making the difference. Not me and my silly meme videos, it's you guys. You have the power in your hands to change the world. And it sounds weird because it's like, you think of yourself as a high school student or a college student, you're like, how can I change the world? You can. And you can do it earlier than you think. You just have to not be afraid to take some chances. Step outside your comfort zone. And as cheesy as it sounds, to stay alert, not anxious, which is my little tagline from YouTube. So thanks, guys. I really appreciate it. If you have any follow-up questions, put them on my YouTube channel. I am so active in that comment section. I try and answer as many questions as possible. I also have a little Reddit community. Throw questions on there. If I can't answer them, there's even moderators that I've created who do a great job of directing people to more information and continue doing great work.